Hi, good evening everybody. So tonight's live stream is all about buttock pain, specifically in runners, but to be honest, it will apply to people who walk or just the general public as well. Hi Westy, I see you've joined us. Okay, so first of all, to introduce myself, to those of you who've not met me before, my name is Maryke. I'm a physiotherapist and I have an online physiotherapy practice called sportsinjuryphysio.com. So if you ever wanted a bespoke program that's specifically worked out for your condition and your needs, your training goals, then you're welcome to contact me. Good, so let's jump right in. As always, I'm going to start with teaching you a little bit about the anatomy of the buttock and what's going on in there so that you can understand why I suggest the treatment approaches I suggest. So your buttock is actually quite a complex area. We tend to think that it's just a bum full of fat and muscles, but it's where everything comes together for the lower limb. So you've got your lumbar spine or your lower back coming in, your sacroiliac joint where the lumbar spine and the sacrum attaches onto the pelvis, and then you've got your hip muscles and you've got your nerves running through. So I've got a picture here for you that takes it down in layers. So let me just orientate you first. There we go. So on this one, you're looking at the leg side on. So to show it on myself, it's looking at it this way around. So you can see the lovely, nice little fat buttock muscle, the glute max there, and then the IT band on the side running towards the knee. And that bony bit there is the ridge you can feel there, which is your top of your pelvis. Then if we look at this picture, you can see that they've cut the glute max away. So now you can see all the smaller muscles fanning out and running from the hip bone or the top of the femur to the pelvis. Okay, and to the sacrum is there. Now, to show that on me, let me just see if we can get a slightly wider shot on this. That should work better. If you take hold of your pelvis at the top there, so that's the pelvis, it's not actually the hip. You can feel the hip bone down there. So from the hip to the pelvis, you've got your glute min, your glute med running there, you've got your glute max over them. If I turn this way around, you've got your lower back, then if you can see where the dimples is where the pelvis comes and attaches, or where the sacrum sits, attaches into it. Sorry, my hands, it's difficult to move it backwards. So if you can imagine the sacrum as a triangular bone that sits about there, and your lower back, the spine comes and attaches onto that. Okay, then from there you've got your big pelvic bones coming out, but you've got loads of muscles running over that. And then you've got your sciatic nerve, which comes out, gosh, why am I so disorientated? Kind of like that, and runs down the back of your leg. Okay, now the piriformis muscle that everybody likes to blame for buttock pain runs kind of in this direction. Okay, so I'm going to place it around that area, roughly. So, common causes for back pain. The first and most common by far is just a regular strain of something in that area. So, a strain of the ligaments of your lower back or your sacrum, or even of the hip, the ligaments that runs between the sacrum and the pelvis. Pure strain of the buttock muscles. So anything where you've gone for a run and you had a sudden sharp pain, that usually indicates that you strained something. And it's usually accompanied by either sprinting or stepping over something quickly, or jumping something, or even slipping. Now the second very common cause for buttock pain is actually from the lower back, so referred pain. And often that type of pain is in this area. It's not very well localized, and it can feel quite deep. It can, if your sciatic nerve is also irritated, go down the leg, but very often it's just in the buttock. And that can be anything from, it can be your facet joints in your lower back that's annoyed with life. They can either be injured or they can just be really tight and stiff because the muscles are tight around them. Say for instance you're sitting for long periods in the day and you don't move a lot. That's a common cause I see for that. It can be a disc injury in your lower back. That can refer pain into the buttock. Then we move on to the sacroiliac joints, which I couldn't find a nice picture in my book today about that. But the sacroiliac joints is, if you can picture this again, that sacrum that you have that sits in there, and you've got your coccyx there. So the sacroiliac joint runs there, and they're quite broad joints. And usually, when they are painful, they tend to be painful over that spot, but it can refer into the buttock as well. Then we have bursitis, I can never say the word, trochanteric bursitis, which basically means it's on the side of the hip there, and that's where, you know, where the IT band comes down again. So this IT band runs right over your top of the femur, so where you've got your greater trochanter of the femur, and you've got a fluid-filled sac, or several fluid-filled sacs there actually, which is meant to reduce friction. They're called bursa. But now, if the IT band for some reason rubs over that too tightly, it can cause the bursa to get irritated and thickened, and they can become really, really painful. And you may even, if you've seen the doctor about pain on the outside of your hip before, he may have injected, and it may have helped quite a bit. So cortisone injections can help for that, but often pain on the outside of the hip is misdiagnosed as bursitis and is actually something else. And in that case, you will find that an injection actually won't help. Another common cause for pain on the outside of the hip is glute med tendinopathy. Now, it's quite a mouthful. All that means is that remember, even your glute muscles or your gluteal muscles have tendons that attach into the bone. And it's when you strain that tendon that attaches into the bone that you can develop a tendinopathy over time. So a tendinopathy is an overuse injury where you've either loaded the tendon too quickly with exercise that it wasn't used to, or you have repetitively done exercise in periods where it hasn't recovered from the previous bout of exercise. And when I say exercise, it can be running, it can be walking long distances, it can be that you ran a lot and then you walked long distances. So anything where the muscle and the tendon didn't get enough time to recover. And that pain is quite often also felt deep inside the buttock, kind of in that area there. But if you leave it for too long, it can spread to the whole buttock and everything can feel really, really painful and sore. Okay, so Malcolm's saying that he's just been diagnosed with piriformis issues again. Many happy returns. I'm going to get on to piriformis syndrome in a minute because that one's also a bit of a tricky diagnosis. Okay, so that's glute med tendinopathy. Then somebody else in the group asked me about snapping hip. So snapping hip you get often in dances, and that is when the IT band flicks over the greater trochanter or the bony bit of the femur there, and you literally get a loud snap that can sound really explosive as they walk. Now that can be caused by either really tight structures, or it can be that actually these people have a bad habit of dropping the hip out and that their stability isn't great, and because they put it in that position, the IT band has no choice but to flick over it. And I will get to the treatment for all of these conditions in a minute when we move on to the treatment, because each of them needs a slightly different treatment approach to it. Then the second last one is a hamstring tendinopathy. Now, if you've got pain right in your butt, so it's where your sit bone is, and often when people have that, sitting is really, really uncomfortable. That's where your hamstring tendons actually attach. And again, just like with a gluteal tendinopathy, if you overstrain the hamstring tendon and don't give it enough time to recover, or you do an exercise bout that's just way too big compared to what it's used to, then you can develop a tendinopathy in that tendon. And it's usually, I've seen people either have it through running, where they stride out too far, or they do a heavy hill session, or classic, if you've got it in the gym, then it's deadlift type thing, because that will really strain the tendon over that bit. Then lastly, there's also the piriformis or piriformis syndrome. Now, the piriformis muscle isn't a very large muscle. It runs, it's a quite a small strip of muscle that runs from the femur again to the sacrum, and it attaches underneath the sacrum. But the significance of that muscle is that your thick sciatic nerve runs either under it or through it in most people. For some people it runs over it, but in most cases it runs either under it or through it. And to give you a better idea, I've got a picture of that actually. Let's see if you can see that. So that's the sacrum and sacroiliac joint. You can see that thick yellow bit is the nerve coming through, and then that muscle there, that strip of muscle, is your piriformis. So your femur outside of the hip is there, sacrum there, your buttock would sit over that. That's your piriformis, and in this person the sciatic nerve is running right underneath that. So you can see that if the piriformis is really tight, it's going to squash the nerve and annoy it. But now, this is a classic chicken or egg situation, because if the nerve is irritated, it will irritate the muscle, which makes it tight, and then it irritates the nerve more. So I must say that in the research as well, there's a massive debate about, some people say you don't really get piriformis syndrome. The piriformis is always a symptom of something else like lower back pain or lower back issues or nerve irritation. Whereas another group says, oh, no, the piriformis drives it all. I would say that in practice, I always leave piriformis syndrome as the last resort for a diagnosis. I always treat it as if it's an underlying back or lower back issue, and respect it in that I'm not very aggressive with my treatment. I politely ask it if it likes to be stretched or not, because if you're really aggressive and you go digging in, you can often really flare it up. I have seen 1 or 2 patients where it has purely been the piriformis, and they have had injections which actually settled their issue fully. But then I've also had people who's had injections where it's really flared it up because it wasn't the piriformis, it was actually the nerve itself that was annoyed, and it just made things really a lot worse. So yes, in my experience, I would always first treat the lower back before I go and hammer the piriformis. Let me just say, Nick, yes, my clunk sound is so loud when I go from knee tucked into stomach down to straight leg. So Nick, does that actually, is it a clunk that goes over the side of your hip? And then Megan says, I can't tell if I have just tight glute med or if they are just weak. How can you tell? That's a really important question. And to be honest, it's always or often a combination of the two. So the tendency is there to, whenever you feel something feels tight and solid or locked down, that you want to stretch it because you feel it's tight, so it should be stretched. But very often muscles can go into spasm because they're trying to protect something. Muscles can go into spasm if they're not strong enough for what you're asking them to do. So they go, oh, mate, we're knackered. We're just going to contract now into a spasm because we can't actually do a proper contraction anymore. So it's not very often that stretching alone is useful. It's very often, 99% of the time, you've got to do a combination of the two. So the first thing to do is to try and identify where the pain is coming from. Now, while I'm saying that, I'm also thinking, actually, you do not need 100% clear diagnosis as to what structure is at fault, as long as you take it very gentle with regards to what treatment you introduced to it. Okay, and the reason for that being, if you have a glute med tendinopathy or a bursitis, and you do heavy stretches for the glutes, bringing the legs over, things like that, that stretches those painful bits over the trochanter even more, you can actually make your pain worse. Same thing, if you have a really irritated piriformis and sciatic nerve, and you go and do hard massage on it, so classically, a massage therapist or physio will go and dig in with their elbow, or you with your massage ball go and really do hard massage, you will again make your pain worse because it's too much for that irritated muscle. Same thing, if you just do stretches, it relieves the pain a bit, and then you go running, you will likely just end up with pain afterwards again if you don't pay attention to your training program. Is it too much? Should it be changed? And if you don't strengthen it up. So let me tell you what I do about if somebody presents to me with buttock pain. I always start at the lower back, see, is there any stiffness in the lower back? Is there any pain that I can get from the lower back? So easy test for that is if you're sitting, can you go all the way back as far as you can? And while you're in that position, can you side flex to the sides? So you're kind of twisting back upwards. If that's pain-free, you likely don't have facet joints that's angry with life. Then also just check, can you bend all the way forwards without any pain in your lower back? And if you do that 5 times, does that stay pain-free? Try and go as low down as you can. If it feels tight, but there's no pain that's been elicited, then I would say you may have some stiffness there that you want to work on, but it's likely not an injury in the lower back. If, however, you did it 3-4 times and you think, oh, that's actually becoming uncomfortable now, then you may have an underlying issue with the lower back, which you also want to sort out. So you likely have to strengthen the lower back and also do a few gentle stretches and flexibility work for it. Then the second thing that I would look at, okay, so that's the lower back. Then we move on to the hip area itself. I usually check, how's the person's range of movement? Do they have tightness in the glutes? If so, is it just a stiff, like a muscle stretch sensation you get when you do your stretches? Or is it actually painful to stretch? Also check, is it painful after you've stretched? Because that gives us an indication of whether, if it's just a muscly stretch feeling, and you're actually feeling either better or the same after you've done it, then stretching it is okay. If it's painful while you stretch it, or it's painful after you've stretched it, then it's not a condition that wants to be stretched at this point. You may use it later on, but for now, you're better off staying away from that and rather doing strengthening exercises or some of the massage techniques I'll show you in a minute. So that's the second thing. So first of all, you check the back. Second, you check, do my glutes actually like stretches? And I'll show you a couple of stretches that you can try for that in a minute, or probably 3. Let me just make a list because otherwise I'll forget. So stretches times 3. Then I'll demonstrate in a minute. Okay, and then you want to check strength. And I'll demonstrate them for you as well. But again, you want to choose your exercises. So what I find in clinic is that if it is anything over the outside of the hip, like a bursitis or glute tendinopathy, it often doesn't do well with exercises like the clam or anything where the leg goes kind of crosses over and takes it into a stretch position. If that's the case, you may have to put something between the legs or do things like bridge exercises where you're working in a straight line but you're not actually causing a stretch into the things that's painful. So you've got to figure out, you've got to test how strong it is. And depending on who you are, what sports you do, what type of life you lead, you will need different strengths in that leg. So for regular me and you who just wants to go running and we're not really competitive, we may be okay if we just test ourselves with like the clam, the side leg lift, can we do a single leg squat? But for somebody who's actually a high level athlete, you're going to have to be able to do those things properly with proper weight and also see how jumping technique and things comes into that. Okay, so we've got that bit. And then if the lower back is indicated as well, you want to look at strength around the core area. So how good are you at controlling your pelvis while your legs move? Good. So that's the type of things that I would want to test in the body, but you also want to think about your training program. So identify, why did this start in the first place? Was it a sudden sharp pain that came on? So while doing a movement, did you jump over something like that? Because then it means that you've likely torn something or strained something. And it will be about 6 to 8 weeks before it recovers. If it is something that gradually crept up in you, then it is likely more a case of something in your training program or other activities that you do during your day that's contributed to that. So classic scenario that I will see is somebody who has been really unfit for several years and then take up running all of a sudden. I think there was actually a question like that in the group from somebody who's taken up the Couch to 5K program. And it may even have been last year that she did. Now, typically, when people do that type of thing, they don't go in and strengthen their legs and things up first. They just go into the walk run program as it is. Now, for a large portion of society, that will be fine. But if you're like me and you're on the hypermobile side of the spectrum, and you don't have that inherent muscle strength, or you're just somebody who actually have been sitting behind a desk for a very long time and not done any physical work to give you muscle strength in your legs, then it means that you actually don't have the control while you're doing that walk to run program to protect your muscles. So often what you'll see when they run is that you get quite a large hip drop and sag, and that the legs turn in. And what that does is, if the hip does that, you're straining the structures over the outside, and it's a classic cause for your bursitis as well as glute med tendinopathy. So what you'd want to do with that case is really work on lumbar-pelvic control, that you can actually keep your pelvis level while you're running. So strengthening up the core, strengthening up the glutes, strengthening up even the quadricep muscles, because if they get tired, other things are going to try and compensate. So basic muscle strength, where is that? So coming back to that running program, other common causes that I see for that is, or where the program can cause it, is if you suddenly start upping the mileage. So you've been doing shorter distances, everything's been fine, but now you start marathon training, and the long runs are getting longer. And what happens then is that you may actually have good form when you're doing shorter runs, but because the endurance is pushing you to a place of exhaustion, you may start losing your form and the muscles get overworked and you can develop a tendinopathy or lower back pain in any of those cases. And then the third thing is where your day-to-day work can actually affect your running. So again, classic cases that I see in practice is people who sit a lot and then they don't do any flexibility work or warm-ups before they go out for running. So when you sit, not only do you tighten up the structures at the front of your hips, your back and everything becomes stiff and tight. Because remember, your joints don't have arteries going into them. They need movement to get fluid in and out. So if you're sitting for hours on end in one position, your joints in your back, your joints in your hips, and all of your both legs actually just get starved to an extent during the day. So if you then don't do a proper warm-up and move them before you go for a run, you can much easier sprain them. And that's one of the causes that I also see. Then there's, of course, the classic one where people do manual work, which involves funny positions and a lot of bending and hard work away from the body, where they strain their lower backs and then go for a run. And the pain presents in the buttocks, but actually it's the lower back. So have a look, think about when your pain comes on, think about what makes it better, what makes it worse, because then you'll start seeing a pattern there and you may be able to fix it. If you think it's your job that's contributing, see if it helps if you take more regular breaks, or if you do a proper warm-up that involves the glutes, and not just stretching, but actually activating them as well, doing squat lunges, things like that before you go for a run. My favorite one to activate my glutes is on my back doing glute bridges, but on one leg at a time. Good. So that would be an important part of the management. Then flexibility and strength I'll show you in a minute. Okay, the third or the last thing that I wanted to say was, if your glute pain is quite acute, that is really, really painful, you may need a period where you actually reduce your amount of exercise, your amount of training, so that it can just get time to recover. Buttock pain is not very kind to runners in that it will allow you to run to a certain extent and then it's going to say, don't like you anymore, and stop all your running. So you're better off figuring out how much running you can do before the pain increases, so that you just keep it at that level so that you don't get to the point where you can't run at all. Okay, and see if you can substitute it with cross training or cycling until you're better. Now, my favorite 3 types of stretches that I do for glute pain. Up, let me just get this thing organized. Now, buttock pain is a really temperamental one in that I've had 2 types of it in the past myself. One was purely from the sacroiliac joint, and when I had that, I found that stretching had a little bit of effect in that it gave me some relief from the pain, but it was actually strengthening that worked for it best. And then I had another one where it was my very lower back that was annoyed with life. And what I found there was if I did a really, really, really good job of stretching my piriformis and my glutes before I went running, then actually that meant that I could get through a run. So it's just about trial and error and figuring out what works for you. So stretch-wise I'm pretty sure you're going to know these stretches. Now, I didn't actually plan to roll around on the floor tonight, so I don't have a mat. Okay, so the first one is just where you cross one leg onto the other one and you grab hold of that thigh and you pull your leg to your chest. Now with this stretch, I really like it because you will feel the part that's the tightest. So sometimes you can feel it in the hamstring, sometimes you feel it in the buttock, and if you're really tight, you can feel it all the way into the lower back. But now remember, it should feel like a stretch. It shouldn't feel painful. If it's a painful stretch, ease off a little bit. If you can't do it without pain, then it's not the right stretch for you. It may also be that actually it's fine while you do it, but then when you come out of it, half an hour later it really, really hurts. Also not the right thing for you. So let me show it from this side. You cross your leg onto that one, you bring your hands through there, and you just pull it to your chest. Now, I use my elbow to just push my leg out a little bit as well, and then you get really a good stretch. So that's quite a general glute stretch. If you want to get the piriformis itself a bit more, what you need to do is cross the leg further over. So you've got a choice of 2. You can either cross your legs fully like that, bring them both up, and then you place one hand on your knee, other hand on the lower part of the leg, and pull both to your chest. So let me show it this way around. So you cross it fully, then you bring them up, one hand goes on this knee, other hand comes on this lower part, and now I'm going to pull with this hand, so I twist the leg, and I'm also going to push at the same time with this hand, so I'm pushing this knee to my shoulder. And you can feel quite a strong pull in the buttock. Now you can do it with your other leg down there. So show you like that it's there. Or you can even have the leg straight. So it's a little bit like the pigeon pose they do where you're on your front. I don't like the pigeon pose because it puts too much strain on my knee, so I find this one a little bit kinder. So if the piriformis is an issue for you, that's a really good one. But remember, you're not pulling as hard as you can. You're taking it to the first point of resistance, so the first point where you feel a bit of a stretch, and you hold it there. Because the aim would be, if you're using these stretches, the aim is to switch the muscle off. So it's not a sharp stretch or a hard stretch, because then you're just going to annoy it. You want to make it a gentle stretch, but a sustained stretch for 30 seconds or longer, so that we get a switching off effect. Okay, and you want to repeat it about 3 times on each leg. Now the third one is kind of a combined, it rotates your lumbar spine, so you get a bit of a stretch there, and then it stretches this bit as well. Now, if your lower back has a disc injury, it may not like this stretch, so be nice and careful with it, please. Also, if you've got a gluteal tendinopathy or a bursitis, it often doesn't like this stretch. So see if you find it useful. If it's painful over this area, just don't do it. You can do the other one, so you can do something else with it. I'll show you how to use a massage ball in a minute. So taking it to that side. But in the same sense, some of my patients who just have a lot of like muscle tightness, there's no injury there, it's just stiffness of the lower back causing a lot of issue, or facet joint pain, they find that stretch really useful. Okay, so where do you start by strengthening or with strengthening these muscles? Um, I'm only going to concentrate on three, and it would be the standard three exercises that I start people off with, but I often have to adjust them because they can even be too hard for certain people just because of the type of injuries they have. So the first one is just the regular old clam, and I'm going to be nice to myself and give myself a pillow. So you stack your legs and you want about a 60-degree angle, and all you want to do is lift that leg up and slowly back down. Now, what you don't want to see is that you roll backwards while you do that, like that. Okay, this has to stay there. You pull your tummy muscles in and you're just lifting that out. And you can see my left leg is a little bit lazy. It should be actually going to there. Now, it's all about the slow down, the eccentric control. If you have a muscle that's really weak and irritated, you may find that it does that. So you come up and it can't go slow down. You have to be able to do a smooth movement all the way down. If it's painful to be in this position, because for some people, even that is too much of a stretch for the painful structures there, I usually place something between the legs so it doesn't allow the leg to go below hip height. And then I would actually just get them to hold it there. So if you find that the clam irritates it and you can't do it, you could always try just holding it there. And the other mistake people make is that they try and force it as wide open as they can. And I've had one or two people put their buttocks into spasm because those muscles are so annoyed. And then if you force it, they just don't like it. So you're much better off at the beginning just taking it into the position, and can you hold it there for 10 seconds before you then slowly bring it back down again. The big thing with these exercises is just finding the thing that works for you. Okay, now what's normal for that is what they tend to want to see is that you can do 25 slow repetitions with really good form in one go. Then you know you're strong with a clam. Another good one is, and actually that's where a wall is handy, where you do a, whoops, I'm going to send something flying there, where you do a side leg lift, okay? And the reason the wall is handy is it can keep you in the right position. Because what people often tend to do is they allow the leg to come forwards, and then it's more the quads working and not the buttocks. So what you want to do is make sure that it's in a very straight line, and that when you take it up, you can really feel the buttock working and not the front of it. Okay, so if you don't have a wall, what you can do is you can, if you have your leg there, just try and take the whole leg back to the point where you can feel the buttock activating. And it's in that position that you want to slowly take it up and down. Okay. Now I don't have that big a range of movement laterally in my hip. That's my full range. So if I try to take it higher, I'm going to start doing that and pushing myself back. So make sure that you actually just go in your normal range, because otherwise you're going to compensate. Okay. And again, you're looking for an endurance of about 25 that you want to be able to do of this. But now, once again, if you've got bursitis or tendinopathy, it may not actually like this at the beginning. So check. If you do, I always do a trial test first. Do 10 repetitions, see what the 24-hour response is, and if it's happy with it, then you know you can do it. But if it makes it ache afterwards, this little exercise should not be causing you muscle ache or pain afterwards. If it does, it's not the right exercise. Then the last one, very simple exercise, but an extremely effective one to get things going. And it's a very nice one for the lower back as well. So it's just the glute bridge, where I like to roll up just to get some flexibility through it. Now the key thing is to get your heels as close as you can to your buttocks, because if they're too far away, you're going to get a cramp in your hamstring. So bring them as close in as you can, and then I like to do it as a spine curl, where you curl your spine up, but you don't have to go up that way. Now, what I don't want to see is that you try, like in yoga, push all the way up, because then that just involves the lower back. What I want to see is that you keep your tummy muscles in, so the lower abdominals, the pelvic floors, you squeeze your bottom and you use your buttocks to get your hips straight. So at this point, I'm not feeling my lower back because I'm not overarching it. I'm just taking it to where it's straight, but I can really feel my bum working. Now, what you can also do is if you're on your heels, you're going to get your buttocks working harder. So if you come up from there and really squeeze your bum, squeeze your lower tummy muscles, so squeezing your pelvic floor, not holding your breath, and you count till 10. And that's a very good place to start. From there, you can make it harder by lifting one leg up at a time, wanting the pelvis to stay level always, and you can even work onto single leg glute bridges or placing your legs onto things. So there are loads of ways to make that harder. If you're in the gym, leg press is an excellent one. Stay away from the machine that pulls or that you push your legs open with. I've had more people injure themselves with that thing than what's useful. And if you think about it, the position you're in on that machine is not functional. No, I can't actually think of any sport or any situation that you would be sitting in this position, which is essentially what you are doing on that machine, and bring your legs in and out. It's not functional. It's not how you work. You're not strengthening anything of use. And all I find is that people annoy their sacroiliac joints and stuff with it. So if you've got buttock pain, then I would rather stay away from that machine. Okay. The last thing. Let me just see. Am I ignoring people's questions again? Yes, I am. Okay, so Malcolm says that his physio said his back issues is maybe causing the piriformis. I would definitely say if you've got a back that's a bit dodged, then definitely. Tony says my right glute gives up after about 8 miles of racing. What's the best way to solve this? Is it just a weak glute, as I suffer with lower leg pain once my glute fails? Tony, what would be useful to know is if this is a new thing that's come on, or whether you've had it for a very long time. The other thing that I would want to know is if you have any lower back issues with it, because it can be part of lower back stuff as well. If you're able to race up to 8 miles without an issue there, it means that there's a capacity issue, in that at 8 miles, whatever it is that's causing your trouble is saying, you're now going past what I can do, and I just can't work now. And yes, then the other muscles are going to have to work harder. So what you need to do is you need to identify, you need to keep your running down to the level that it can do without giving out. And in the meantime, I would then definitely look at your lower back. Is there anything that needs more flexibility? Is there anything that needs strengthening? Look at your glutes. Is there anything that needs strengthening versus flexibility? And work on that capacity. But if it gives out in racing, my gut feel is going to be that it's not going to be a flexibility issue. It's likely going to be more a strength issue that we're dealing with. Then let me just see. Oh my dear, where has my picture just gone? Can you guys still hear me? Because it seems as if I've just gone black here. I have no idea why that's just happened. Oh, don't do this to me. Okay, this is strange. I'm going to continue talking just for a moment and hope this thing comes back online. Okay, so Westy, what stretches for total knee replacement? You know what? I'll make you a new video for that in a minute. Because this thing's video seems to be absolutely stupid now. Okay, guys. Oh, you can still see and hear me. Okay, good. That's a bit weird. I'm glad I didn't pick my nose. I can't see myself at the moment, so I'm just going to go for it then. Okay, so I'm just going to quickly show you the massage for the glutes then. And Wesley, then I'll show you the stretch that you can do for a knee replacement. So good old tennis ball. I've shown you this several times in the past few weeks, but it really, really works. Now, if you have quite a painful glute, I would start off with doing the massage technique against the wall, because I promise you, if you're going to go and hammer a piriformis muscle or even a glute med, any of those that are really irritated with life, and you put too much pressure through it, you're going to make it worse. So when you're doing it in standing, it's much easier to actually kind of regulate the amount of pressure you put through it. So to show you this again, if you've missed it in the last couple of weeks, what we're looking for, and remember this is useful for ITB syndrome as well, is so this is the top of the pelvis that you can feel. If you go straight line down, you'll get the knobbly bit of your greater trochanter of your hip bone. There I can feel mine. Now you've got the fleshy bit of the glute med and glute max and everything running in that bit, and that's the bit that we want to massage. So we're going to massage that, and into this bit. So what you do is you place the ball in the part that you want to get. Now I tend to try and relax that leg that I'm massaging, because otherwise I just brace it and I can't really get in there, and I use my leg that's further away from the wall to put the pressure through. And then at the beginning I do roll a little bit, but I tend to press more. So I find a tender spot and I just hold it there. And it's a firm pressure, but it's a comfortably uncomfortable pressure. It's not a painful pressure. And then you can angle yourself slightly to get different parts of it. And usually when I'm kind of in this position there, then I'm more on the piriformis part of it. Now, if you feel that actually, no, your glute's not that irritated, it can handle deeper pressure, then tennis ball and mat like that or floor like this will just run away from you. So either use your exercise mat or pillow to keep it in place. This pillow is too thick, it's not going to work. Let's see if I can keep it in place like that. Up. And then it's exactly the same thing, except you can't see me. Except you'll kind of be lying sideways onto it, and there's no rocket science to it. You take it onto the tender spot or the painful spot and you just ease into it. But yeah, this floor is really not ideal because I'm trying to shift and the ball's just going with me. So use an exercise mat, it works well, the rubber holds onto it, or just a regular carpet will work as well. And yeah, spend about 5 minutes, 6 minutes on that. It works really well. If you can't actually stretch the muscles because it's too painful, then this can work, but just don't go and put it on the bony spots, especially if you've got bursitis, it will make it worse. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.